If any of you attended Leman 2 years ago and attended my talk, I sort of gave the front side of this, how we were struggling with influenza and how we attempted to control it. And so what I want to do today is kind of give you an update on that and then also provide some data to that Monse and Marie and Jorge have helped us understand if what we were doing was actually making a difference. So you guys have seen the slide before if you've heard me talk about influenza, but the way I think about influenza, it's one of the big four when I think about wake up in the morning in our system, along with PRRS, PCV2, and mycoplasma. And so they're priority diseases that we spend a lot of time and effort and money to try and control and then struggle with. So a significant impact of cost in influenza has been reported anywhere from $3 to $10 per pig. I really do agree that some other people have said this as well. We really need to understand what that true cost is of the industry so we can continue to focus on it and have some better studies out there. But I think everybody that deals with influenza on a day-to-day basis in a large system would agree that that's probably a good estimate of what flu may be costing us. For me personally, it's more frustrating than PRRS. There's so many more additional dynamics. It changes rapidly. There's the human component. There's the avian component that we have to deal with from a biosecurity standpoint. And there's also the sort of public health component of influenza, which at times can make things very challenging to have a discussion about flu and to move the ball down. If you think about what happened during the pandemic more recently. It's a complex disease, and we put it in complex systems, so just like PRRS, it's one of those things that we constantly are struggling with. There's a general misunderstanding, in my opinion, of influenza and oversimplification of flu when we talk about flu, both as veterinarians but also on farms and in systems. We talk about flu like it's one entity, and it's not. It's several different isolates, strains, clades, however you want to classify it. And so we just can't talk about flu as one individual thing. And for a long period of time, we just had this misconception of how flu moved around in the system. And over the past several years with the work that Monse and her team have done, as an example, the previous talk that was just given, is we've gotten to understand this a lot better, particularly the impact in how influenza is transmitted within sow farms that I don't know that we really appreciated, say, 10 years ago. And in my mind, it's as much of a pig flow transmission, so some people would call this vertical, although it's not directly from sow to pig in utero, but sort of a pig flow transmission challenge as much as it is lateral introduction of influenza into grow pig populations. Okay? And so that's the piece that we've kind of focused on is what does the sow farm do as far as prevalence of influenza going into the downstream pigs. And so I'm going to roll through some of the supporting research, and a lot of this is, all these slides are provided by Monse, but work that she and her team have done over the years that sort of laid the groundwork for this thought process is, one is we know influenza prevalence is year-round. There's definitely a seasonal component to it, but we can still see influenza in June, July, and August, right? And so that leakage, and this is information on wean pig status coming out of sow farms, that prevalence and constant leakage of influenza out of sow farms year-round needs to be recognized. In addition to that, within a sow farm, the highest prevalence of influenza circulation is incoming gilts and the wean pig population, particularly in this continuous flow farrowing house setup. And so it really shouldn't be a surprise to anybody that this stuff happens. In addition to that, from a vaccination standpoint, sow vaccination we know reduces wean pig prevalence, okay, so vaccination of sows. And in another study, it really didn't matter how you vaccinate, whether it was a pre-farrow vaccination or a mass vaccination, any sort of vaccination of the sow herd was better than not as far as reduction in wean pig prevalence. In addition to that, some of the work that was done is sow farm vaccination reduced homologous transmission. So again, much more complicated. Flu is not flu. Flu is multiple different isolates. We always have to consider the homologous versus heterologous immunity and transmission when we do it, but we did show heterologous transmission, or reduction in heterologous transmission when vaccinating sows. In addition, the work that's done post-weaning, wean pig population factors, still defined in what those may be, influence post-weaning transmission in the nursery phase. And in our system, the biggest place that we have challenges with influenza causing production loss is in those nurseries, right? Particularly if you have PRRS circulation on top of influenza circulation. So that's where a lot of our production impact is in the nursery. And so we want to see what we can do about the wean pig status to impact that. And then also within a sow herd, some more work that was done, co-circulation of influenzas in that piglet population, making the sow farm sort of a reservoir for diversity of isolates that are going out there. And on top of that, if in anybody's system, if you've got, say, 5 different sow farms with different influenza statuses and maybe more than one type of influenza circulating, And then what do you do out here is you commingle all these sow farms together to rapidly fill sites. You've almost compounded that problem, all right? So much like we talk about with PRRS, is like, how do we control this wean pig population coming out of the sow farm? How do we stabilize influenza? So all that research kind of led into this strategy and program. And so what I'm going to explain today is what we do in our north region within Smithfield hog production. So we monitor our multiplication and gilt flow. We're fortunate that we sort of manage that internally within our system. The way we do this is we just check the box for influenza on our oral fluids that we're testing for PRRS as well, right? So it's an easy check the box and additional test. So we know what the status of the gilt is. We're lucky that a lot of our sampling and monitoring would indicate that we have flu-negative gilts coming into sow farms. Not always. Sometimes we actually have human introductions into some of those sites, but for the most part, we're controlling influenza at the entry point into a sow farm. Our goal at this point is to protect the breeding herds. Any of you that have been through an influenza break in a sow herd know that it can be pretty devastating as far as abortions and loss. But where we are in our density, protecting the breeding herds constantly is a focus for us. We're going to control the sow farm, and mostly we're going to try and control this wean pig. And our goal for several years within our region has been to produce a robust, stable wean pig, whether that's for flu or PRRS, PCV2, mycoplasma. We've increased our age and our weight in a lot of our farms. And what we talk about is a turnkey pig. I want to produce a turnkey pig that is his best chance, because once it leaves the sow farm and goes into nurseries or wean to finish or commingled flows in the density of population we have, I have less control over what happens to that pig. So at least I can start fresh or try to start fresh. So we actively monitor our breeding herds, and this is through the wean pig monitoring, and I'll tell you how we do that. And currently we're utilizing autogenous killed vaccines to help stabilize these farms. So our vaccination strategy, our standard is seasonal whole herd. So we do this twice a year, and the target is usually February, March in the spring, and August, September in the fall. And the goal here is really to and you'll ask, well, August isn't really in the fall, but we're trying to booster the sow herd to get a stable pig with a high level of maternal immunity when that pig is going to be in the nursery in the tail end of September and October. That's when we start, in our area, that's when we start seeing circulation of flu here. And then also the tail end of March, April, coming out of the season, usually we'll have weather events, cold rain come in our area of North Carolina and Virginia that sort of seems to transmit disease as well. So we kind of have our spike later in the winter than other places as well. And in addition to that, based on our monitor, which I'll talk about, we may do additional whole herd vaccinations depending on what the sow farm monitoring is telling us. We do some pre-farrow vaccination. We do it as necessary relative to this monitor. And usually where we do that is farms that turn over frequently. We have a couple of gilt farms, P1 farms. We have some batch farms, so it's really nice to be able to maximize that maternal immunity in those pigs in a batch system. And then herds that are unstable based on the monitor, where we've got positive wean pigs and or some close post-clinical aspect of influenza in a nursery. Maybe it's a continuous flow nursery. Usually there's PRRS involved in there as well, and we're going to try and control the flu aspect of that. So we use both of these systematically. So our commercial breeding herd monitor, we started this in July of 2016. So we're almost we're 2.5 years out, and a lot of the data you guys are going to see on this. Monthly sampling, so once a month we're doing snout wipes. We haven't moved to the udder wipe thing yet, but we've been trying to figure out how to be confident in doing that. Currently we're doing 12 litters randomly, and we pool by 3. So of those 12 tubes, we pool by 3s. We've done some work internally on looking at the sensitivity, and that works really well for us. So we're getting basically 4 PCR results. All of this is going to the University of Minnesota currently. And if it's PCR, if the pool is PCR positive, the CT is less than 35, we'll try and split that pool apart and test the tubes individually and try and get a lower CT, and we'll attempt to sequence. This wouldn't be standard, but we're trying to at least get the sequence information to be able to match to our autogenous program. If it's less than 25, we've got a pretty good chance that we can actually get a pretty good sequence and attempt virus isolation. And our success rate has been really high on the virus isolation with those lower CTs, particularly sending samples to the U of M. And then if we can't get a really good sample, we can't get a sequence, or we can't get a virus isolate, and it's in a farm, or it's something we really want to try and get our hands on, we'll go back in and resample, whether with nasal swabs, additional fluid, oral fluids. We'll increase our, nasal swabs or nasal wipes. We'll go in and actually try and get that virus out of an individual farm, all right, and be a little bit more aggressive on it. So this is how we kind of report it. So this is basically each week of the month that we report, and so each of these farms will submit at least once a month an X with an asterisk. Well, an X means that it was submitted, but we don't have a result yet, and an X with an asterisk just means that we have a final result and it was negative. And then what you see on here is basically if it's a blue box, it was positive for flu. And then once we get the sequence information or the subtyping information, we'll kind of put that in there. And this gets emailed out every week to all of our production team and all of our farms, so they know what the status is. And we have one very similar for PRRS as well. So they're kind of getting a constant PRRS and flu monitor. And then what we'll do from this and this information is I've got a spreadsheet that I'll track basically every individual potential isolate that comes through the diagnostic lab. And this is for our monitoring samples, like here with nasal wipes, but anytime we're doing other sampling, so oral fluids or tissues or just, these would be kind of the random isolates that come in on diagnostic workups, right? So we're trying to track and chase every influenza in our system. And then we'll put the, the subtype in here, just some other information, the lowest CT that we find, and some of that's for analysis later. And then whether we were able to actually get an isolate of influenza, and then all of these isolates would be automatically forwarded to our autogenous vaccine company that's making and updating our vaccines. So we'll keep track of this, and so our autogenous vaccination strategy is we target the most prevalent and consistent isolates across the system. So as we look at it, we're looking at flows, we're looking at geography, we're looking at the volume of pigs that are potentially affected by that positive system, whether we're commingling or maybe it's a 10,000 head sow farm versus a 1,000 head sow farm. So we take all that into consideration. We prioritize candidates for our autogenous vaccine for isolates that directly come from the sow farm, because that's where the vaccine is going to go back into. Doesn't mean that we won't potentially take another isolate from, say, a nursery workup or a finishing, but we're trying to stick with the sow farm information. In addition to comparing the current vaccine isolates that we have in our vaccine with current field isolates, both what we're monitoring but also clinical pig samples, right? So not just the monitoring from the sow farm, but tissues from the nursery or grow finish or oral fluids or whatever. In addition to that, with help from Marie here at the University of Minnesota, is we also try and compare it to other stuff that's out there circulating in the North Carolina region, right? We don't necessarily have access to that. But Marie can help us understand if this is similar to other stuff that's circulating in the region. In addition to that, we have to have an adaptable virus that has sufficient yield. So some of the virus isolates we get just are not adaptable to cell culture. We don't get a high enough yield to have a successful vaccine, so they sort of regulate themselves out. And then in addition to that, we'll do some evaluation of sow herd response with homologous HIs if we have significant changes in our isolates in the vaccines. Major changes of isolate type or antigenic regions. So this is kind of what it goes through. We'll have a sequence report here. This in red would be our current vaccine strain for this type of influenza, and what's in blue would be our current monitoring isolates within our region. And actually for us within Smithfield, what's in black would be other regions that may overlap where our farms are as well in North Carolina. And so we just kind of look and compare that and say, okay, well, here was the vaccine. We've got some stuff that's falling in there, but guess what? We've kind of got this emergence. How diverse is that? At least on the dendrogram, that's one piece of the puzzle, right? This is how we used to do it like 10 years ago, and you kind of close your eyes and you throw a dart and you pick your isolate. But in addition to that, some of the work that's been coming out looking at key antigenic site and key antigenic site changes, again, we're looking at these antigenic sites on a particular isolate and looking at it relative to a reference, relative to maybe 3 different vaccine isolates or vaccines that are out there. Maybe this is the isolate in question that we're looking at maybe considering versus other isolates, and just evaluating based on the key antigenic changes, okay? And don't ask me, I'm not doing this. I'm working with Marie to help me with this. But basically, it's a multi-pronged approach to understand what really is the best target, right, rather than throwing that dart. So once we do that and we implement, we get a new vaccine, we get a new cereal, our implementation of this is a seasonal whole herd. We determine at that time if a vaccine update is needed, and we try to do this 4 to 6 months ahead of time, so we have the lag time of vaccine production. We're ready. And again, our target would be August, so we've got to work back on that timeline as best we can. Coordinate a vaccine order and distribution, and this actually takes a lot of time in a large system like ours. At times we have multiple cereals. We have the old cereal and we have the new cereal, and we can't just throw away the old cereal, so we've got to figure out where to place that. So what we do is we communicate this plan, so all the farms in the system, we define sort of the range of when we're going to get all these whole herd vaccinations done in the fall. So this is this current year's. We've got the serial numbers listed, identified for each farm, and that's based on what we found in your farm, what the risk is. Some of these that are using older cereals have a history of very little influenza challenge, and so we'll put the vaccine in there and just instead of just throwing that vaccine out. And then the other thing is we have to bulldog it. And so my technician will actually manage the sheet for us, and at the tail end he'll send this out every Friday. And these farms that don't have a date yet put into our event log, he's going to bulldog it. He's going to go find it. I don't have to chase it down, and he's going to continue to send it out, and he's going to copy their supervisors to ensure that we get the date. And we'll log this date, and this date has been used in part of the analysis that I'm going to show you, in addition to which cereal was particularly used. So in general, we're testing, we're monitoring it, we're getting those isolates, we're evaluating the isolates and making an update to the vaccine, we're putting it back into the sow farms and testing. And so it's just this constant process. All right? So that's what we do. And so that was the plan. And we've been working with Monsieur Marie and their teams for a while on influenza. And so the question I had is, help me understand if all this work that I'm doing is worth it. Is it making a difference? Okay? We're spending a lot of time and effort to do this, but is it working? So we provided a bunch of the information, and Jorge has been working on this analysis for us. And so basically this is the sampling result I showed you. It's just transformed into the data that was analyzed. And so in this case, a lot of you have seen this for like a PERS monitor. So those that are in red would be when the months that those individual farms were positive. The green would be where they were negative, and the white is obviously no sample, no data, or we can't determine the status. So then this information sort of translated in a proportion of sampling events that were positive from the start of the study, so July of 16 to January of 19. Pretty nice trend in amount of positive sampling events that are going through. Essentially positive wean pigs or positive samples by farm kind of deal. So a nice downward trend, but again, sort of, is this significant or not? Did we have an impact? And realize that we're changing vaccine along this path as well. So it's not just the same vaccine, we're updating and changing it, so there should be a stepwise pattern or a stepwise change if it's being successful. So this is sort of that vaccination program, and what we have is the boxes that are yellow are color-coded for vaccine serial A, and then as we've changed it to vaccine serial B or C or D, and then what's in red are the positive samples that we were able to extract a sequence, right? Sometimes you don't get a sequence. You just get a PCR positive, you know it's positive. And then using this sequence data relative to the isolates that are in the vaccine, there's additional analysis that needs to be done to understand if that's important. But just looking at the positive versus negative over time, that data was taken and transformed into the 3-month results prior to the vaccination event versus the 3 months post-vaccination event. And those data were compared around that vaccination. And so we've got that for each vaccination event seasonally. And so the comparison is multiple comparisons over time. And so here is in each grouping, sort of a grouping of those 3 months and the prevalence before and after the vaccination event for each of those time points. And then the colored arrows indicates the change in the cereal, right? So at the beginning, everything was on the same cereal. We had an update here that everybody used. This year, it got a little complicated because we had old cereal we had to use and a new updated cereal and some test cereal. But basically, everything is referenced back to the individual farm, what cereal they got relative to what they were seeing in the field based on their samples. And so in some of these, we've got in the p-value of whether there was a difference on this and this would be the very first autogenous vaccination event in our system. Prior to this, we were using commercial vaccine and had made the decision that our isolates were different enough. So this is the very beginning of this whole program that I've been talking about. And so this was a one-time vaccination in the fall, in December, so really late in that year. And we didn't really see a difference during the winter, but when we came back with that same isolate in the spring, there was a significant difference in change in prevalence. Okay, so maybe that's time, maybe that's season, or it's just a function that we got all those sows a second dose of the same cereal, same vaccine, and had that pressure. Okay, if we had had this vaccination in earlier, like we currently do in August or September, maybe we could have delayed some of this. And this is just volume and pressure. All right. Here in October of 17, there was a trend to the opposite way, but they realized that we had made a change in the cereal because we saw new isolates coming in. And that's common for us, right? Everybody sees that. That's part of the challenge with influenza and updating vaccine. And then again, here in the spring, we were able to see an increased change in that relative to the vaccination. And some of this would be, revaccination of this cereal back here on a particular farm, or a new vaccination cereal that was utilized. And so in some of these events, we've seen a significant decrease in influenza. So with that, some more work that needs to be done. There's the homology analysis. So this is just positive, yes, no. And so all the sequence information relative to what's in the vaccine versus what we found on the farm and how that relates, that analysis needs to be done. I'll continue to follow this over time. We're continuing to do this program. I'd like to continue to evaluate if we're having impactful changes when we change our vaccine isolates. The next step of this, and probably one of the questions that I would get, and I'm interested to see what Marie's going to say on the next presentation, but we're doing all this to make the wean pig more stable because of our nursery challenges with influenza. So my question, if I was in the audience, is, okay, well, did it affect the nursery, right? Are you seeing an impact? Did it reduce mortality in the nursery? And so we don't know. We haven't looked at that and evaluate that yet. But so we've created this stable pig. Can we see a difference in mortality and the growth downstream? It gets a little confusing in our system because we do so much commingling, and a lot of that commingling is to get away from continuous flow. So we can have all in, all out by site, because the continuous flow is always a challenge for us, particularly with influenza and PRRS. And then we haven't done a lot of active monitoring in the nurseries here recently. That's one of the things we've been considering about adding that piece to correlate back to the sow farm. But again, that commingling makes it a little bit of a challenge to interpret. So with that, flu continues to be a significant pathogen and a significant pathogen of focus within our region. Our current focus is still on the breeding herd at this time, although we do have a lot of challenges in the nursery. Flu stable negative wean pigs can't be a bad thing. This paper here indicated that influenza in the pre-weaning period was associated with increased post-weaning mortality. That should not really surprise anybody. I'll be interested to see what the next presentation, if it supports that or not. The current program, it takes a lot of time, a lot of effort. I honestly believe we could hire somebody to do nothing but think about flu in our system 24/7, but we have other things that we have to do. But this is important enough for us to take time. And with the information that I've showed, it's nice to see that all that work sort of indicates that we've had some sort of an impact, right? Reduction in wean pig prevalence for influenza at least. But there's still a lot more work to be done with influenza and understanding some of like the nurse sow component. We do a lot of nurse sows, and that's an interesting aspect. Some of the other things of moving pigs around, how do we, not just for influenza, but for PRRS, right? So how do we stop that transmission within farrowing houses? What other activities, other management strategies can we do to reduce that circulation in that continuous flow population?